Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and I'm a PT assistant. Today, I'm interviewing Rick Olderman, who is a physical therapist, and I'm going to ask him different shoulder and arm pain questions that you, our audience, had for him. Things like rotator cuff or forearm injuries, even upper trap issues. So, without further ado, here is Rick. Next question is a torn rotator cuff. So this person says, I have a torn rotator cuff, been in physical therapy for several weeks, had last visit last week, does not seem much better, trying to avoid surgery. Any suggestions?
Well, this kind of goes back to that other question about the impingement that this person was feeling here. So if you remember, first of all, the rotator cuff runs from the inside of the shoulder blade all the way through this little cave here to the arm bone. It's not the only rotator cuff muscle. There are 4 of them, all right? And sometimes if you have a tear in one, it means that you have perhaps a tear in or more in one of the others too. It's not uncommon. So we know that the rotator cuff is inserting at the top of the arm bone here. One of the things that could be, and usually the rotator cuff is tears happening somewhere in this region. Usually what's happening is that arm is hiking up prematurely and re-tearing or irritating that tear that's there, causing it not to heal. Why would that be happening? Well, because the other rotator cuff muscles, for instance, the infraspinatus and teres minor, aren't depressing the arm bone the way it should be doing. And I'm sure that you've probably been doing all of these. If you are, good job. The second reason is because the shoulder blade isn't moving out of the way of the arm bone when the arm is moving. So the shoulder blade should be rotating 60 degrees ideally and elevating when the arm is moving away from the body. If it's not doing that, then the arm is going to bump up into the top of that shoulder joint prematurely and re-tear or cause irritation to that tear. So again, that hands and knees stretching back like this can go a long way to restoring the scapular mechanics to offload the rotator cuff. All right. So initially that might be painful. I wouldn't recommend moving into pain because that pain is indicating that you're bumping up into the tear. So if you can do that pain-free, great. But if you can only go back this far, then just start with that far and go from there. You can also do this on a wall. If you put your hand on the wall, and usually I have the pinky side against the wall, and you slide the arm up like this, this also starts to engage that shoulder blade system to start pushing the arm up instead of your rotator cuff muscles pulling the arm up. So that would be 2 exercises I would start to recommend with. And also, if you have your hand here, that's going to be more impingy than if you have your hand out to the side a little bit. Like I think scaption is 30 degrees out to the side, Mike? Is that right?
Something like that. 30, 45.
Yeah, 30, 45. Somewhere around here is less impingement oriented than a motion straight up here. And this is too far. So it's somewhere in between those two. And different people have different sweet spots that they like better. So play around with that. But sliding the arm up on a wall, or when you're doing this, have your hand out to the side a little bit more as you're doing that to get it into a better range of motion, to start coaxing that scapula out of its perhaps locked position. Because the scapula gets locked down with shoulder injuries. The serratus anterior, which is controlling the shoulder blade, tends to adhere to the trunk because it's trying to protect this. So it needs to be coaxed out of its little protective spasm.
I'll have to have my parents try these. They both have kind of impingement-like issues. They're functional yet, but
it's very helpful.
Yeah, they've never tried the prayer type stretch stuff.
Oh yeah, and one other thing, especially if you have really tight chest muscles, well, the chest muscles are attached to the front of the arm bone here. And so what they do if they're tight is they cause the arm bone to be internally rotated. Well, our shoulder joint doesn't like internal rotation. If you try to lift up your hand with your pinky side up to the ceiling, that's maximum internal rotation. And even me just doing this, you can see my shoulder just jams, right? It doesn't like that. So your chest muscles are one of the muscles that cause that to be excessively internally rotated. So stretching the chest muscles, maybe by lying on your back on the ground and just having your hands out to the side and doing a little floor angel, like a snow angel kind of motion, can start to open up your chest muscles and release the internal rotation force acting on the arm bone, which will again cause it to be less impinged as the arm is raising.
All right. Well, thank you for joining us again. Where can people find more information about you at?
If they go to rickolderman.com, I have lots of free stuff there. I have some blogs. I have all my home programs, my practitioner training program, and there's a contact form there, of course, for me that you can use to reach out if you like.
Okay, perfect. Well, thank you for joining us.
My pleasure, Mike. Thanks for having me.